Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is where we like to focus on ways to help you live a healthier, happier, and pain-free life. We'll be taking your calls and answering any questions that you have based on our topic, which I'll mention in just a second, and we'll answer those questions live. So we'll be opening those phone lines in about 5 minutes. But when we do, remember when you do call, you call in a quiet room with your TV turned all the way down so that we can hear your question. Our number is 318-219-4569, and today we're talking about something that's pretty common. It's hypertension, high blood pressure, and we're joined by Dr. Jeff White, the expert on this topic, cardiologist to be exact, with Willis-Knighton Cardiology South. Thanks for joining us.
Well, thank you, Courtney.
First time on Healthline, right?
It is,
yes. So this is exciting.
It is.
And hypertension's not really exciting to be diagnosed with, but that's what you're going to help us with today.
That is true.
Hypertension's fancy word just for high blood pressure.
Yes, that's
okay.
right.
Tell us what it is.
High blood pressure is very common, one of the most common problems in American medicine and culture. And it is that the force that is generated by the heart and is going through the vascular system is too high. And so it puts stress on the walls of the arteries with every heartbeat.
Yeah. Okay, yeah, and this is something that can damage over time, cause damage to those blood vessels.
Absolutely, in multiple organs throughout the body. Hypertension has what's called end organ damage, and it puts you at risk for multiple problems throughout various organs in the body. Very important, if at all possible, to control it to help prevent that.
Okay. If somebody does have high blood pressure, typically you would get it checked when you're at the doctor's office, right? They typically call it like when you're in triage and they get all those vitals and things, but it's not something that you really can feel those symptoms, right? Or are there some symptoms in extreme cases?
Hypertension has been called for many years the silent killer because just what you said, it generally lacks symptoms. Is generally found incidentally on a blood pressure check. In more severe and extreme cases, it can cause symptoms, headache, blurred vision, but generally when the blood pressure is very high. Most of the time you don't know you have it. Yeah,
that's what's scary. Like you said, the silent killer, because it can be deadly if not taken care of.
Yes.
Right? It's something that's maybe more chronic. Not if you have it doesn't mean it's a death sentence right away. You can take care of it, but you definitely want to take care of it sooner than later, for sure.
Absolutely. Yeah, you know, studies have shown that if you just drop your blood pressure by 5 points, you lower your cardiovascular risk by about 10%.
Wow.
So it's even small improvements in blood pressure can have profound effects long term. Right.
Okay. And so you said 5 points. So we're talking about that number.
Yes.
Can you explain what is a normal number and when we should be concerned?
So when we measure blood pressure, you'll hear us say a number such as 120/80.
Right.
The 120 is the systolic blood pressure, and that's the pressure that is the maximal force that's generated when the heart is contracting. The lower number is the diastolic blood pressure, and that's the number when the heart's relaxed and it represents vascular tone. When the blood vessels are not under the stress of the pumping action of the heart.
Okay, and 120/80 is kind of that, what you hear time and time again. Is that a good rate to aim for?
You know, over the years and throughout my long career, we've progressively lowered the target for blood pressure. But presently, yes, we think that a normal blood pressure would be below 120/80.
Gotcha, okay, and anything higher or elevated would be considered elevated at this point?
So a blood pressure between 120 and 130 systolic is considered elevated blood pressure. If you have a blood pressure 130/80 and upwards, that generally 130s/80s, that's stage 1 hypertension. Anything over 140/90 and up is stage 2 hypertension.
Okay, and so we have medications and things now that can help do that. But first, you know, what causes hypertension to begin with? Is it just genetic, or are there other lifestyle factors?
Certainly genetics plays a role in it, but much more importantly is lifestyle. So if you're doing things that are unhealthy, if you're smoking, if you have excess alcohol intake, if you're taking too much sodium in your diet, if you're sedentary, if you're not exercising, all of those lifestyle factors put you at increased risk for hypertension.
And stress too, can stress also increase?
Stress does. Stress is interesting. It can short-term cause an acute rise in blood pressure. Long-term effects of stress are really more mediated through the lifestyle changes that come when you're chronically stressed.
Yeah, like the alcohol. Some people, alcohol or food and lack of exercise, or you know those things. Yes, like you said, can cause it to worsen. So yeah, those are the things that cause it. But with the genetic risk, how much is that actually contributing versus the lifestyle?
Not much.
Okay.
It's far and away lifestyle.
Okay. So we really want to get the lifestyle under control for sure. And a lot of the things that you've said that are contributing factors for lifestyle can affect many other chronic diseases.
Yes, that is true.
And a lot of times when people have hypertension, they may also have another chronic disease, would you say?
It does run with a bad crowd. So,
yeah, okay. And so with those lifestyle changes, what would you say is something that's really important to tackle? You mentioned many,
Sure.
but what's the most important one in your opinion?
I think stopping smoking is probably the most important if you're smoking, because not only does smoking put you at risk for hypertension or worsen hypertension, has other just myriads of adverse health effects. So I guess if I had to order them, I would say stop smoking. If you're just going to do one, quit smoking.
Okay, yeah, and that's a big one. That can affect a lot of other things too, but especially those blood vessels. What does it do exactly to your blood vessels?
So smoking puts you at risk to harden your arteries and make them more stiff, and also to develop plaque in the arteries, buildup of fatty debris and cholesterol debris in the walls of the arteries, which then puts you at risk for peripheral vascular disease and cardiac disease and stroke, smoke and renal disease affecting the small blood vessels in the kidneys. So smoking is really a terrible thing.
Right, yes. Okay, well, if you're just joining us and you have a question for Dr. White, give us a call. That number is right there on your screen, 318-219-4569. We are talking about hypertension specifically, so if you have a question related to that, or if you have hypertension and you have a question related to your condition, give us a call. That number will stay up on your screen for the remainder of our visit. Okay, so talking about medications, it's kind of, really revolutionized the way that we treat hypertension, and it kind of takes it away, if you will, with those medications. So what are those over-the-counter medications or prescriptions that maybe you suggest?
So first of all, in general, if your blood pressure is not too high, we'll initially give lifestyle modification a try.
Yeah.
Lose some weight, quit smoking, cut back on your alcohol, start exercising. And then if that does not get you down to where we want you to be, then we'll talk about drug therapy.
Okay.
Generally, you'll begin with something like a diuretic, which will pull out sodium and water out of the body, because hypertension is mediated by sodium intake in many people. And then there are a variety of other medicines that you can layer on in addition to that if you need to control blood pressure.
Okay, yeah. I've also seen where even just a couple pounds of weight loss can help someone decrease their blood pressure significantly.
Absolutely. If you can lose 10% of your weight, you don't have to get all the way down, but if you just begin, it will lower your blood pressure, generally in the range of about 5 or 10 points.
Yeah, that's incredible. And then you said lowering it 5 points. What was that statistic you said earlier?
If you lower blood pressure 5 points, you're going to decrease your long-term cardiovascular risk by 10%.
Yeah, so even just a couple of pounds of weight off can help you significantly, not only with the blood pressure, and if you're taking the medication, a lot of times I see that people just want to have this freedom from taking all these pills.
Yes.
And so those lifestyle changes can also help them reach towards that goal.
Absolutely. You'll see patients who have been on blood pressure medication for a long time who lose a significant amount of weight, who will be able to come down or even off their blood pressure medication.
Yeah, that's incredible. That's awesome. Yes. Okay. Is there other medications or over-the-counter drugs that you've seen that can actually raise someone's blood pressure?
Yes, important to know that. In particular, the non-steroidal anti-inflammatory drugs often raise blood pressure. So drugs like ibuprofen or naproxen, branded as Motrin or Naproxen, are very common offenders.
Yeah.
Some decongestants, particularly those with pseudoephedrine, can raise your blood pressure as well.
Oh, okay. Yeah, so if you have a cold or if you have a headache, then those things, you should know those things. If you already have high blood pressure, that could potentially elevate it. Okay, what is your recommendation? If someone is sick, do you encourage someone to avoid those drugs?
No, I don't think so. I think for an acute illness, you're fine to take those unless your blood pressure is just very high to begin with. But long-term use does predispose to elevation of your blood pressure.
Okay, yeah, so if you are sick, it's okay to maybe take it, maybe talk with your doctor just to make sure, for sure. Okay, so there's also foods. We've talked about sodium, or the high sodium diets mean fast food. Very high in sodium.
A common offender, yes.
Yes, and a lot of times if you just go through the fast food drive-through, typically anything that you order is going to be half of your sodium needs for the day or more. So what are those other foods that you typically talk about with your patients to avoid?
So generally processed foods in particular, processed meats will be high in sodium. Many canned soups will be high in sodium as well. The amount of sodium that we should be taking in, it's really not very much. If you take a teaspoon of salt, that's about 2,300 milligrams, which is your entire dietary daily allowance for salt.
Right.
In general, if you want to go lower, go to fresh fruits and vegetables, chicken or fish without added salt. But processed meats, processed foods, soups, prepared foods, fast food in particular, they'll get you over your sodium limit pretty quickly.
Right, and if you think about it, sodium is a preservative too, and so those processed foods are shelf stable, so they have to have a lot more sodium so they don't go bad as quick. So good tips there for sure that we want to avoid. Unfortunately, it's also food that typically seems to be a little addictive and it's hard to get off of.
That is true. That is true.
But also, I think salt can in some ways be an acquired taste. The more you salt your food, the more you're going to want it.
It's an interesting point you bring up. Certainly salt makes food taste better for many people. But if you modify your diet and you cut down on the addition of salt in what you're cooking or what you add afterwards, in general it's thought that you will readjust your taste for food in about 2 or 3 weeks. So if you can get through the first 2 or 3 weeks, you can get there and then you won't miss it so much. Yeah,
and then you try something that's maybe you used to have that, or you salt it the way you used to and you're like, whoa, this is really salty. I can't do this anymore. Right. So yeah, really a good perspective there that you can do it, and once you get over that hump, it's probably going to be difficult at first, but then you won't probably miss it.
I think that's a fair statement, yeah.
Well, maybe try it out for yourself. We'll see. Okay, so we keep talking about how great exercise is for obviously many different things, but why specifically is it good for your blood pressure?
Exercise improves your cardiovascular tone. It improves the compliance or the ability of your blood vessels to dilate. So if you will get about 30 minutes of exercise, and generally we say aerobic exercise, brisk walking, but also other conditioning exercises are beneficial as well. Isometric exercises, weightlifting has some benefit. I think perhaps not as much as aerobic exercise, but if you can work in about 30 minutes, say 5 days a week, that is a very good thing in terms of modifying your risk for high blood pressure or helping lower your blood pressure if you have hypertension.
Okay. Would you recommend 30 minutes straight, or is it okay to do 10 minutes 3 times a day?
We all have these devices now that fuss at us if we haven't done a certain number of steps. I think 30 minutes straight would be fine. If you can't do that, if you can get a total of 30 minutes of exercise in the day, that would be fine.
Right, yeah, and it breaks up your day, so if you do have a sedentary lifestyle, which is not great for blood pressure, then it can, be a way to break up the sedentary throughout the day if you have a sedentary job. Okay, so aerobic exercise like walking's better, but the strength training is maybe not specifically great for the blood pressure, but can be good for other things. So if you have a variety.
Good for physical conditioning for sure.
Yeah. Okay. So this is one of my favorite questions that I'm a dietitian, so I get this question a lot. Sea salt, pink Himalayan salts, table salt, is it really any different? Is it going to just do the same thing for your blood pressure?
No, salt is salt.
Yes.
In whatever variety it may come or however it's labeled, salt is salt.
Absolutely. Yep. Thank you for clearing that up, because you heard it first from the doctor. It's funny how there's these health halos on food. Sea salt came out a couple years ago, and even the pink Himalayan salt. that it seems like it's healthier, maybe it's more natural. It's salt. It's going to do the same thing, and it's going to taste the same. It may taste a little different, but you know, depending on the types or the flakes, you know, but yeah, still going to do the same thing. Unfortunately, it's still going to increase your blood pressure. So, okay, so when you mentioned a couple of minutes ago that with your patients, if it's slightly elevated, you really encourage the lifestyle changes.
Yes.
At what point do you typically recommend that medication?
So in general, with stage 1 hypertension, we're talking there in the 130s over 80s, we'll try lifestyle, and we'll make a pretty good effort at trying to do that. If you have other things that are going on, if you have diabetes, if you have pre-existing kidney disease, then we'll be much more likely to treat in that range, in the stage 1 range. By the time you get to stage 2, generally at that point, you've done what you can with your lifestyle and you're not there, and at that point we'll begin pharmacologic treatment.
Gotcha. Okay, so it really probably depends on the person too.
It's individualized, yes.
Yeah. Okay, so with hypertension, I feel like it's one of those chronic conditions that can kind of be a gateway for many other chronic conditions. What in your, what you've seen in the last several years does it typically lead to? We've mentioned the renal disease, but what else?
Yes, so hypertension puts you at increased risk for heart attack. It puts you at increased risk for stroke. And it puts you at increased risk for kidney failure or damage to your kidneys in particular. It also raises risk of dementia as well, probably mediated through small vessel disease as well. So, it target damage and can put you at risk for retinopathy, for hypertensive retinopathy, changes in the back of your eye as well. Any place that you have blood vessels, hypertension can do damage.
That's pretty much everywhere,
That's
right?
pretty much everywhere.
Dementia is really interesting because of, you said, the small vessels in your brain. Okay. Yeah, that's pretty scary too. So with the renal disease or chronic kidney disease, what about high blood pressure causes it to lead to kidney failure?
Yeah, so the kidneys are basically a tightly bound organ that is made up of tufts of blood vessels. Very small blood vessels, and so that filter the blood and they filter the waste out of the blood. So they're small and they're called nephrons. So in a nephron inside your kidney, the blood will come in. It'll go through this tuft of very small blood vessels and then come out the other side, and they filter it out. Those small blood vessels are damaged by high blood pressure. They'll get sclerotic. In people who have advanced kidney disease, if you take a biopsy and look at it under the microscope, a lot of those blood vessels have just been obliterated. And that is mediated by many things, but hypertension is certainly a major risk for that.
Yeah, and unfortunately, once that damage has occurred, you can't really recover.
That is true.
Yeah. And the chronic kidney disease, once you, not to go on a tangent, but once you get to those stage 1, 2, it's kind of similar to high blood pressure. You don't really have those symptoms yet. Yeah, and so that's what can be really scary, and one of those organs that we don't want to compromise.
No, we have two, but they're equally affected.
Oh, right, yeah. Okay, so what are some of those, going back to the medication, a lot of people are on high blood pressure medication, and what are some of those side effects, though, that you see in your patients? So a common side effect from treatment of high blood pressure is dizziness, and you often see it perhaps in patients who may be somewhat older. Their blood vessels are somewhat stiffer, and if you lower their blood pressure, particularly if you lower it quickly, they can become dizzy. There are some older patients in whom you'll let their blood pressure ride a little bit higher. You might take 140s or maybe 150s if they're prone to get very dizzy when you lower their blood pressure. There are certain blood pressure medications called ACE inhibitors, and about 1 in 20 people who take an ACE inhibitor will get a dry cough that is mediated through a particular biochemical pathway that is affected by the drug. The drugs that are called calcium channel blockers that are used for hypertension often cause edema or swelling in your feet. I get a lot of folks who complain about that when I use those drugs. And so you'll combine a diuretic with a calcium channel blocker to try to offset that. But dizziness, edema, a little cough,
probably the most common things you'll see in patients who have hypertension. Beta blockers are not as good. They'll treat hypertension, but they're not quite as good as those other drugs. But if you take one, beta blockers can cause fatigue in some people, can cause nightmares in some people, and in certain asthmatics can make them somewhat worse. The diuretics will in some people predispose them to gout as well. So it's drug dependent, I suppose, but those are the common things.
Okay, but I mean, here again, you would say it's by and large worth maybe going through feeling those things.
Yes, absolutely. A little bit of edema in your ankles is a cosmetic problem for most people.
Right.
And you get much better benefit if you lower your blood pressure by taking your medicine.
Absolutely. Okay. And if somebody is against, I mean, some people, it might be difficult to address the issue if it's hard to get them to want to take that medication. It's just at that point the lifestyle changes.
Yes.
Okay. And it can be done.
It can be done.
Okay. So let's say my dad had high blood pressure, probably still does, but he doesn't really check it. It's something that he should do, but he would check his blood pressure when I was a kid. Is that something that you would recommend as someone to get an at-home blood pressure
Yes,
check?
absolutely. So the most accurate home blood pressure cuffs are for the upper arm.
Okay.
Automatic blood pressure cuffs. You ought to bring them in and have your doctor calibrate them or validate them. And then after that, if you have high blood pressure, you ought to check your blood pressure several days a week. And you can check it both in the morning or in the evening. Blood pressure will vary quite a lot during the day. But over time, you can look at the average. Sometimes blood pressures run higher when they're checked in the doctor's office. That's called white coat hypertension, but will be okay at home. But in general, if you keep a log, you want to average it out, and you want your average. We would certainly like to see your average 130 over 80 or below.
Okay. So it's similar if you had diabetes. You'd want to check your blood sugar several times a day to get that average, because it's going to vary. When would you say? Why does it vary throughout the day, or is there certain reasons why?
Yes. It has something to do with hormonal changes like epinephrine. Early in the morning when we first wake up, we get a surge of epinephrine that helps us clear our head and wake up, and blood pressure can run higher during those times. Later in the day, depending on what's going on, you may be more stressed,
right,
and have your blood pressure run higher because of that. It can vary a good bit even during one day.
Okay, yeah, when you're at work versus when you're at home, right?
Right.
Yes, okay. And so you want to check it. Maybe if you don't have one, they have them at the Walmart or the grocery store. Those are pretty accurate?
I think they are. I think they are. The wrist cuffs are not in the guidelines. I tend to think the wrist cuffs are fine if you carefully calibrate them as well. But the guidelines would say that the most accurate are automatic upper arm blood pressure cuffs.
Okay. And if someone when you have patients that have high blood pressure, do you follow them regularly?
Yes, it's important to do that, to keep your regular checkups with your doctor. Bring your blood pressure log in. Very helpful to see that data when as a doctor, when your patient comes in, you can spot trends or changes that can help you adjust the timing of the medication or the dose of the medication if you need to. So keeping a little log it's really very, very helpful to your doctor.
And if they notice something, like if it's trending up above 130 over 80, is that cause to call in to your doctor?
Yes, I think so. If you become worried about your blood pressure trend, just call. And at that point we can decide what needs to be done.
Absolutely, yes, okay. And so if someone's blood pressure is controlled, but they're taking medication, do they just continue taking that medication, right?
Well, it's kind of like being in an airplane at cruising altitude, and you say, well, we're doing fine, should we shut the engines off?
Right, yeah. I mean.
No, if you're controlled on your blood pressure and you're doing well, take your medicine. Occasionally you'll be able to titrate it down, again with weight loss or other lifestyle modifications, but that's done carefully. In general, once you need medicine, you're probably going to need some medicine unless you have extraordinary success in your lifestyle modifications.
Yeah, so you never want to titrate it down yourself or stop completely, because then that could maybe cause some adverse effects.
Yeah, I think it'd be best to keep your doctor in the loop on that.
For sure. Okay. And When as we age, is that also a factor that
Yes.
increases the blood pressure?
As we age, our blood pressure tends to go up. And again, that's because of hardening of the arteries. And so those arteries are less compliant, so the force of the cardiac contraction hits a stiffer artery, and that generates a higher blood pressure.
Mm-hmm.
And again, sometimes we're a little more permissive over 65, but nonetheless, keeping that blood pressure down and at target, even in that patient population, is very important, unless you're limited by other symptoms, like dizziness or symptoms that the patient can't tolerate.
Right. Okay. Do you have any, so going back to the blood pressure monitoring at home, do you have any specific recommendations?
Mm-hmm. So to do it properly, you ought to sit down, uncross your legs,
Okay.
rest for 4 or 5 minutes, and then take the blood pressure at that time. Generally, a good idea to take it around the same time so that you get consistency at that time in your blood pressure measurement.
Okay. And so I went to the doctor recently, and my blood pressure was elevated as soon as I sat down, and so she rechecked it, and it was normal. So is that pretty common?
It is pretty common. You've walked in from the waiting room, and sometimes a long way from the parking lot.
Right.
And so you've had an appropriate rise in your blood pressure because of the exercise. It takes a little while for that to recover. So yeah, oftentimes it's good if you're initially high to just come back and recheck it after about 5 or 10 minutes of rest.
And during exercise, it's elevated just because your blood's pumping a little bit more.
It's abnormal for your blood pressure not to rise when you exercise.
Okay, which is kind of counterintuitive. You'd think, well, we want to exercise, but it increases, but it helps. What would you say is the process of?
Well, when you exercise, your oxygen demand goes up substantially. Okay. You're working hard. You increase your respiratory rate. Your muscles are needing more nutrients and blood flow. And so your vascular system will respond to that by raising your blood pressure and your cardiac output. And then after you stop exercising, it'll lower. So the rise in blood pressure with exercise is a good thing, unless it's excessive, and does not produce long-term harm. It's a conditioning effect.
Right. Okay. Conditioning. Yeah, that's a good way to differentiate. Okay. So with back to school season, kids are going back to school, and maybe they've had their physical. And is that something that you also check in children, the blood pressure?
It's interesting that the Pediatric Society guidelines recommend that you ought to have your baby's blood pressure checked when they're 3 years old.
Wow.
Then certainly by the time you have an adolescent child, it's good for their blood pressure to be checked at least once a year, and of course to be checked on their routine visits to their doctor as well.
Okay, and it's possible for children and teens to have elevated blood pressure?
Yes, we're seeing more of that now as we see more obesity in younger children and adolescents. And the pediatricians will tell you that in general, those same blood pressure targets that we talk about for adults would be important, particularly in adolescents and older children.
Okay. Is it recommended for that patient population to take medication if it is severe?
You try a lifestyle modification pretty hard for a child first. But if you can't get there, and particularly if they're in their mid-late teens and we're above those targets, you would treat.
Okay. So with being a cardiologist, with patients, do you need referrals from their primary care physician, or can they call you directly to get scheduled?
It varies by doctor's practice. Some doctors like to have a primary care referral, and I think it is important for everyone to have a primary care provider, and keep that provider in the loop. Many primary care providers are perfectly happy to manage high blood pressure. We're happy to help.
Yeah.
And the patients that we see for other cardiac problems, oftentimes we will step in and adjust the blood pressure medications as well. But certainly this is a primary care disease for many people.
Got it. Okay. And if they did find that they needed specialized care with you, where can they find you?
Well, Willis-Knighton Health System has an online referral line that will direct you to a specialist or a doctor of your choice.
Okay.
So that's a good way to do it.
All right, sounds good. Thanks for joining us, Dr.
Oh,
White.
my pleasure.
This was great information. And if you missed this and you wanted to maybe rewatch it, we have this all on our website. That's ktbs.com/podcast, or you can also find it on Spotify. We're Healthline 3. Thanks for joining us.
Thank you.